I want to raise the issue again of the audiology misdiagnosis in the West, in Mayo and Roscommon. You'll know that 49 children were affected by this, where they weren't diagnosed, where they had hearing loss and it wasn't picked up when it should have been picked up in the screening. So you have 49 families now who are left trying to cope with what has happened. And I would call it a scandal, because it was allowed to happen because the proper clinical governance wasn't in place to make sure that human error or that couldn't be picked up on. So what we need to happen now is we need the Minister to get directly involved in that. We need, for the report has been out for the last 4 weeks, we need urgent action around the services and supports that need to be put in place for these children and for their families. And that includes speech and language therapy and other therapies that are really necessary, as well as other physical hearing aids and whatever else needs to be done. But that needs to be put there urgently, and it's not good enough to say that, you know, there's a special package of care put in place, because I've been talking to these families and that is not the case. The care package hasn't been put in place, and I want to see what extra resources have been put into that area, because the speech and language therapies and all that, the waiting lists for them as they are at the moment, without even this latest scandal, is unacceptable. So there has to be additional supports put in place. These families, each of them, have to be contacted as well. It's not good enough for the HSE just to wait for the families to contact them. The families are very afraid that should they create a fuss or contact the HSE around it, that the limited services that they get may be withdrawn from them. So they need to be, and I would encourage those families to come forward and to speak out as well. And I thank the ones that have already spoken out on it. The Minister needs to make sure that there's a redress scheme put in place for this, because there's a long-term impact on these children in terms of their audiology problems going without being treated. So the redress has to be put in place as well. But it cannot be left just go on month and month. So we need urgent action on this. And Leader, I would ask you to bring that back to the Minister, to not just leave it in the hands of the HSE. He has a responsibility as well to make sure that action is taken quickly. Thank you, Cathaoirleach.